Okay, so we're going to start with Module 1, Chapter 1 on the basics. Okay, these are our learning objectives from the standards that are in your syllabus. Okay, so you're taking a class in structure and function. And basically what that is the structure part is the anatomy. So anatomy is the study of the internal and external structures of plants, animals, but in our case, it's the human body. So we will solely focus on the human body. And anatomy is the Greek word for to cut apart. So prior to being able to cut apart a person, people did not know what was inside a person. And they would do these drawings if they were lucky enough to see a wound or be able to somehow see inside the human body. There is microscopic anatomy and macroscopic. Micro meaning small, macro meaning large. So microscopic is basically anything that you can only see with magnification, such as a microscope. So think at the cellular level. So microscopic anatomy is our anatomy at the cellular level. Macroscopic is, or we call it also gross anatomy, not that it's gross, but is large scope. So that's the structures that we are able to see with the naked eye, aided or unaided, and that includes x-rays. So x-rays would be considered macroscopic anatomy. Physiology focuses on the functions. So that's where structure and function, that's where your class comes in. So physiology essentially is the functions and processes that make up the human body. And we have lots of types of physiology. Obviously, we have human physiology, which is going to be the focus of this course, animal physiology, cellular physiology, and neurophysiology. So there are subspecialties, but for this course, we'll be focusing on human physiology. So anatomy and physiology put together, basically that's the structures. Anatomy is the structures of how things are put together, whereas physiology is the study of how those structures work together to make the body function as a whole. This whole course, the main focus of this course, and one of the main themes that you'll see over and over and over again throughout this course is homeostasis. Homeostasis meaning internal balance or equilibrium. And the body has a small window that makes things compatible for life. And it is constantly readjusting itself to maintain homeostasis. Human anatomy and physiology, or your structure and function class, is the foundation of all medical practice. So all students in the study of any healthcare profession really need to understand human anatomy and physiology. And pathos meaning disease, is the study of disease or the study of the function of disease. Okay, anatomical position. This is very, very important for you to know, and you are going to need to know the correct right and left when you label things. So very, very, very important for you to know. When we say anatomical position, we're talking about a human standing erect, face forward, feet parallel, arms hanging toward the side, palms facing forward. This is the right and left is their perspective. So it's their right, their left, not yours. So I'm not sure if you could see my mouse circling above this. This would be the right arm. If I'm looking at it, it looks like it's to the left. But in that person's perspective, it's the right arm because it's their right arm. But try to work on getting that in your head. Okay, we have some directional terms that will help you in any field of healthcare. Superior and inferior. And that everything with directional terms is from your point of reference. So in other words, superior means toward the head or upper body, and the head being cephalic, cranial, the skull. So superior means toward the head. Inferior means away from the head or toward the lower part of the body. And we'll try a few exercises with this. Okay, so the forehead is blank to the nose. So I'll pause here a second, give you a minute to try to do those, to try to figure these out, and then I'll show you the answers. Okay. Oh, we don't have a slide with the answers. I'll give you the answers. Okay, so the forehead is superior to the nose. The first answer is superior. The lips are superior to the chin. The heart is superior toward the head to the liver. The umbilicus, or the belly button, is inferior to the breastbone. The knee is inferior to the hip. It's away from the head. And the stomach is inferior to the lungs. Okay. Then you have anterior and posterior. So anterior or ventral mean the same thing, towards the front of the body. Posterior or dorsal, think dorsal fin on a shark, means toward the back of the body. Okay, so where a dorsal fin would be is posterior. I'll give you pause a second and let you do this. You can also pause this recording. So I'll give you the answers. The breastbone is anterior to the spine. It's toward the front. Your front teeth are anterior to your back teeth. And your spine is posterior to your heart. Okay, medial and lateral. Medial, think medium or in the middle, right? Is near the middle or midline of your body. And lateral refers to the body parts away from the midline. So if we have a midline that cuts us kind of in half at our nose in the middle of our body, anything toward the sides of our body is lateral. Anything toward the middle is medial. So here, the nose is medial to the ears. It's toward the middle. The lungs are lateral to the heart. They're closer to the sides. Proximal versus distal. Proximal is, and this can get tricky because remember, it's referring to a point of reference. So proximal refers to body parts closest to a point of reference. So proximal is kind of closer to your trunk. And distal is further away from that point of reference. Hopefully this will make more sense when we try one. External means toward the outside, where internal means toward the inside. So your external jugular vein versus your internal jugular vein. Superficial means toward the surface of the body, whereas deep means away from the body surface, kind of deeper towards your core. Or superficial means toward the outside of your body or the body's surface. Central versus peripheral. So central refers to locations around the center of the body. that core again, and peripheral refers to the extremities or outer regions. And most of the times we use this with central nervous system. In the central nervous system and peripheral nervous system, the central nervous system is the brain and the spinal cord, whereas the peripheral nervous system is everything else. Okay, body regions. And you need to kind of memorize these regions, maybe draw or practice labeling a person or yourself. But these regions of the body help us to communicate anatomy in specific terms. You've got the nasal region, and the orbital region would be the eye. The buccal region would be the cheek. So you're going to want to kind of go through and talk through and memorize these regions. Some of them are a little easier. You may know deltoid from exercise. Some of them may be more difficult, like sural. Okay. The body regions, also we have abdominal regions. We have abdominal regions and we have abdominal quadrants. When we're referring to regions, we're talking about 9 regions of the abdomen. And this can get real specific to where someone is referring. So let's start in the middle. That's kind of easy with your umbilical cord, your umbilicus, your belly button in the middle, okay? And from there, epi means above or upon. Gastric means stomach. So it's like above the stomach, okay? Hypo means below. So we have below the stomach region. So that's the center. Umbilicus, easy. Epigastric above it, and hypo, lower, gastric below it. Then you've got your other sides. And remember, this is left according to anatomical position. So you have hypochondriac, which is the left hypochondriac referring to the ribs. You have the left lumbar region. If you think lumbar, lower back, kind of. Left iliac or inguinal. So iliac, this is your iliac crest. And then on the right side, same thing. Iliac, lumbar, lower back. Hypochondriac, which is below the ribs. A little simpler are your quadrants. So you've got and remember, anatomical position, this is their right. So right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant, and the associated organs inside those quadrants. You've got their midline. Okay, body planes. These are imaginary lines. We use them a lot, especially surgical procedures, radiological procedures. So you need to know these planes. You've got, let me see if we divide them out. Yeah, let's divide them out and we could see them one at a time. Transverse is your horizontal plane. I always think of like a magician cutting a person in half. That's a transverse cut. Trans means across. So it's dividing the superior region, toward the head region, with the inferior region or toward the tail region or caudal, so below. And so this would be a transverse view of your abdomen. Okay. Median is also referred to as mid-sagittal. So any cut in this direction, up and down, is sagittal. The mid-sagittal is one directly in the middle, and that would be dividing your right and left sides of the body equally, exactly. So sagittal lines are drawn vertically, and mid-sagittal is the one exactly in the middle. So this example you can see below here of the head, that's a mid-sagittal view. It's not a transverse view, or you'd be looking kind of down into the head. Okay, frontal or coronal. divides your anterior and your posterior. Okay. It kind of reminds me of a swinging door elevator, or the rotating door that comes around as an entrance or an exit in cities. It divides your anterior, your ventral, and your posterior dorsal sides. So as you can see, this view of the thoracic organs here, this is a frontal view. Okay. For this course, you'll also need to know body positions. So supine, think on your spine, supine spine. You're laying face upward on your back. And this is used for some examinations, x-rays, lots of things. Prone is laying face down on your belly for back exams, certain types of surgery. If a patient has breathing problems, or a pregnant woman or the elderly, they may have difficulty laying in the prone position. Trendelenburg. Trendelenburg is head lower than the patient's feet. And a lot of beds will do this automatically. You can, the electronic beds will do this. Why would we do this? If someone has low blood pressure, or goes into shock, this is great for bringing blood back to the head and vital organs. Or also abdominal surgery. You do not want to do this with any kind of recent eye surgery or cerebral brain injuries or bleeding, because it increases too much pressure in the head. Here we have Fowlers and semi-Fowlers. Fowlers would be, we also call this high Fowlers, a 90-degree, someone sitting at a 90-degree angle. Semi-Fowlers would be a 45-degree angle. And it helps with breathing, comfort, feeding someone so they don't aspirate. The lithotomy position used, so the person would be supine with their laying on their back, feet elevated in stirrups. And this is for examination of the pelvis or lower abdomen. Oop. I don't know why this slide is not coming up with a name on it, but this is dorsal recumbent. It's in your book. Again, the person is lying flat on their back or supine, as we know, knees flexed, feet flat, and it's examining the rectum or the vagina. Okay, body cavities. So now that you know some directional terms, this should help. And basically, the cavities are talking about open spaces that house and protect organs. So you've got the ventral cavities in the front. You've got the thoracic and the abdominopelvic. Okay. And then in the back or the posterior, you have the brain and spinal cord here. The anterior or front cavity, I kind of mentioned this, has two smaller cavities. So you have your thoracic or chest, containing the heart, lungs, and large blood vessels, and abdominopelvic. Sometimes we call it the abdominal cavity and then the pelvic cavity separate, but abdominopelvic contains all your digestive, urinary, and reproductive organs. And you can tell the separation of the two cavities by the diaphragm. The diaphragm right here separates those two cavities. Okay, your posterior or dorsal cavity contains two smaller. So it's got the cranial cavity or the brain and the spinal or vertebral cavity containing the spinal cord. Okay, here's a little test yourself. So for your answers, you've got 1 would be the cranial cavity, 2 would be the dorsal posterior entire cavity, 3 would be your thoracic cavity, 4 would be your spinal or vertebral cavity, 5 would be your anterior cavity. 6 is the diaphragm. That's a little separator. 7 is abdominal cavity. 8 is kind of both. So it's the abdominal pelvic. And 9 is just the pelvic category or cavity. Okay, membranes. Membranes essentially, and I like this picture, this is the best picture. It's kind of like a big water balloon that you put your hand in, okay? Membranes are very, very important. They line the body cavities. Without them, we would have organs against bone. So they line the body cavities and they do not connect with the outside of the body. So they're kind of internal fluid-filled sacs. They have this fluid, which is called serous fluid, if it's serous membranes. Now, let me see if I can. See this, the parietal, so you have two kind of layers. The parietal layer would be the outside of the balloon. The visceral layer would be the layer of the membrane that lines the hand or lines that important organ. Okay, so that's visceral meaning organ, and then parietal meaning kind of the outside. Okay, and we'll talk more about membranes. So we have serous membranes that are filled with serous fluid and mucous membranes. Some examples of serous membranes are your pleura, which is a fluid-filled sac around the lungs, your pericardium, which is a fluid-filled sac around the heart. Peritoneum is fluid-filled sac all around your abdominal organs. Some of examples of mucous membranes would be respiratory mucous membranes, gastric, intestinal mucous membranes. And here's kind of showing visceral peritoneum lining organs versus parietal lining the outside. Parietal, visceral, parietal, visceral. And here's the pericardium. And you can kind of see in this blown up image here, the parietal layer of it faces the outside, whereas the visceral pericardium lines the actual heart itself. And same thing with the lung here. The outside part is the parietal pleura, which is covering the lungs, or the visceral pleura, which actually covers the lung itself, and then the serous fluid is in the between. Here's an interesting view of the mid-sagittal view. So remember mid-sagittal, if you remember how that cut is, of the peritoneum. And the peritoneum is very interesting because we have omentum, we have mesentery, which we'll talk about in a second. Omentums are extensions of the membrane, and mesenteries are sections of the peritoneum that neatly arrange the blood vessels and nerves to the organ. So mesenteries right here kind of arrange the vessels and nerves to the organ, whereas the omentums are kind of little extensions of the peritoneum. And you can see this better here. Here's the omentum, little projection here. And then mesentery has got some nerves and vessels. Another kind of membrane is a synovial membrane, and that's a connective tissue membrane. And synovial membranes are same idea as a membrane, but found around in the space between joints. So you've got synovial fluid, just like serous fluid, and you have a membrane between two bones in a joint. And that slippery synovial fluid reduces friction. Otherwise, you're moving with bone on bone. Okay, last but not least, we are talking about homeostasis, and that is the main theme of the course. So everybody's body, every human body has a set point. We have a set point for things like temperature and oxygen level and pH and heart rate. Those are the normals, and blood pressure. And homeostasis is monitoring, seeing how your environment is, and maintaining stable equilibrium. Okay. And if homeostasis gets out of whack, that's when disease happens. Okay. So we constantly in the human body make adjustments to maintain that stable environment. And that's similar to a thermostat in your house. We're going to talk a lot about feedback loops. And this is like your first introduction to that. So if it's negative, then it opposes the stimulus. And that is a negative feedback loop. So here's a good example. You are walking around and your body temperature is normal. And then all of a sudden you go outside in August in Georgia and it's hot. And your brain tells the peripheral blood vessels to dilate and you start to sweat. This is your body's way of saying, I don't want to get too hot. Body heat starts to get lost through evaporation of the sweat, and it starts to cool you off, and then your body temperature becomes back to normal, and there you are. Likewise with cold, same idea. If you get too cold, your body starts to shiver, blood vessels constrict, and you may shiver or goosebumps, and that kind of activates muscle activity, which makes heat, which warms you up. Okay, so your body is constantly fighting against too much variation. We don't like too much change. Another example is, and we'll talk about this in great depth with the endocrine chapter, normal blood glucose. Let's see, where can we start here? Your normal blood glucose levels. This will make more sense in the endocrine chapter, but basically, if you eat something and your blood glucose level rises, like you ate a cupcake, your pancreas releases insulin, telling the cells to soak up some of that glucose in your blood because we don't want our blood sugar too high. Then your blood glucose returns back to normal. Okay? Likewise, if your blood glucose level falls and you became hypoglycemic, your pancreas releases glucagon. And I know you don't know this stuff yet, but we're getting there. Telling the liver to release some of the glucose back into the blood. So it raises your blood sugar level. Okay. Here's a little video to help explain that.
Today's video will introduce us to something known as homeostasis, specifically human homeostasis. What exactly is homeostasis? Well, homeostasis is a process that allows us to maintain our internal environment despite dealing with an external environment that is constantly changing. You see, the conditions with our body can fluctuate a whole lot for many different reasons. A hot day outside might cause an increase in our body temperature. The consumption of that delicious hamburger will increase our blood glucose levels. Or the stress from studying from that big test might raise your blood pressure just a little bit. Fortunately, our bodies have mechanisms to counteract these changes and bring us back to those normal conditions where our bodies function best. I'm talking about homeostasis. all homeostatic mechanisms will have three components involved in the regulation. The receptor will sense any fluctuation within the environment and proceed to send a signal to the control center. The control center will then determine what sort of response is required to the change, and it will send the signal to the effector. The effector will then receive the signal and adjust accordingly. When the effector adjusts in a way that attempts to stabilize a variable, that is, bring it back within a normal range, it's called a negative feedback loop. While positive feedback loops also exist within the human body, negative feedback loops are far more common and will therefore be our focus today. So let's look at one of our earlier examples of homeostasis, that is, body temperature. Temperature homeostasis, also known as thermoregulation, is happening constantly within our bodies. Let's see how our body adjusts on those hot, sunny days. A section of our brain known as the hypothalamus helps us detect fluctuations in temperature. It receives signal from receptors on the skin as well as internal structures and decides what should be done. This is just like a thermostat in your house, turning on and off the heating or air conditioning. The hypothalamus links the nervous system, where the receptors are, to the endocrine system, a collection of hormone-secreting glands. If the hypothalamus detects an increase in temperature, it would signal certain glands in the body to secrete sweat, which would in turn cause heat loss due to evaporation. On top of this, the hairs on your body will lay flat, releasing warm pockets of still air caught between them, and the muscle walls of the arterioles will relax, causing an increased flow of blood to the capillaries in the skin, allowing more heat to escape. In cold environments, we would see the opposite happen. The hypothalamus would signal the gland to decrease sweat production, the muscles will cause body hairs to stand on end, and blood flow will be directed away from the outer capillaries and towards the warmer core of the body. We only looked at one example of how stable levels of a variable, in our case temperature, is maintained in our body. But as you can see, homeostasis occurs with many other variables, ensuring that our bodies function at their optimal condition. I hope you learned a lot from this video and will continue to learn all about homeostasis. Thanks for watching.
Created using Powtoon.
Okay. So you saw a negative feedback loop. A positive feedback loop is also called a vicious cycle. I love that, vicious cycle. And basically what it is it increases the magnitude of the change. So rather than resisting the change and kind of bringing things back into normal ranges, set points, it, see, for example, here with, I love this cartoon, ideas for counteracting this. They're trying to resist change. Whereas the feedback, positive feedback, is like more. This is not a good way to regulate the body because basically it's encouraging a change from the set point. It's harmful if it's not broken, but it may be necessary to run a process for completion. And the best example is uterine contractions. So uterine contractions during labor is more, harder. And the reason being to expel a baby. If that wasn't the case, there would be no baby. In uterine contractions, the childbirth kind of abruptly stops the positive feedback loop. Otherwise, a woman would die from increasing uterine contractions. So here is a good picture of it. You've got uterine contractions. The baby is pushing against the cervix, causing the cervix to stretch, and it stimulates more oxytocin, which causes more uterine contractions. And this cycle continues more until we have a baby. And then that stops. Okay, this is the end. Is this the end? Just a second, I'm having internet issues. Yes, this is chapter 1. Just making sure. There are some slides that are grayed out that are additional, but what I've gone over and what are mostly visible are the things that you really need to focus on and know. So that is chapter 1 of the basics.